Hormones in general play such a big role in our bodies. Then why does it seem like it's so often misdiagnosed, or you can only get treatment for your symptoms and not the cause? Dr. Stephen Hotze is back with us, and also joining us are two people who say it's not all in your head. They both kept knocking on doctors' doors until they found the right treatment. And welcome Geraldine Boyle and Joe Leahy. Good morning. Now, Geraldine, I had met probably about 6 years ago when I first came here to work at Channel 11, and we were doing a thing called Take It Off with Deborah. It was about losing weight. And what we realized with all those people is everybody had specific reasons why they couldn't lose the weight, and so it was not one answer. And for you, what I was amazed with you, Geraldine, is that whatever we did, you would work out. You would do spinning for the full hour. You would run for you would whatever it was. And you kept saying that doctors kept saying to you, you need to work out. You need to work out. And then they said, don't work out so much.
And eat less. And then eat more. And then, you know, you're obviously eating too much. Obviously, it's you.
Yeah.
You're doing something
wrong.
But
you were very strict with your diet. You did all those things.
I still am.
Yeah.
Yeah.
And then,
you know, my husband says, I eat the burger, you eat the salad.
Yeah.
I don't eat the burger, I lose a pound. You eat the salad, you gain a pound.
Yeah, like that commercial, right?
Yeah.
So it was like a roller coaster for you. And for you, Joe, it was, you know, you're a man. We mentioned earlier that women are more likely to have problems with thyroid, but you went through this roller coaster as well.
Absolutely, yeah. When I was really young, I had a thymus problem. They treated it with x-rays. 50 years forward, they found out x-rays create nodules on your thyroid. So I had the nodules. Well, biopsy or two later, they found out they were benign. But the treatment was to monitor your thyroid, the nodules, and take a synthetic hormone.
Right.
And I did. I went to an endocrinologist, and he gave me a small amount. And over time, over a couple of years, I started seeing my skin going dry. I got in the fog. I was lethargic, and I knew I had to do something, but my daughter told me I was becoming mellow and I was no longer an ogre.
Yeah. And depression was also a part of it?
Absolutely. There was some of that there. And what I did is my doctor suggested seeing a psychiatrist. He says, you know, maybe it's male menopause, maybe it's this. And I made a decision. I changed doctors.
Yeah, yeah. And Dr. Hotze, you hear this a lot of times. By the time people come to you, you hear a lot of people say, I kept saying something's wrong, and they send me out the door.
That's very common, and oftentimes when the guests come in, or our patients come in, they go, "You're the last. This is it. You're my last resort," because everybody else says I'm normal. And hypothyroidism, low thyroid state, is the most commonly misdiagnosed problem in the country.
Yeah. Is it misdiagnosed, or is it that it's within a diagnosis that's not realistic?
Well, it's misdiagnosed and undiagnosed, and the reason is because most physicians don't think about it. If they do think about it, they use the wrong way to evaluate it. If they discover it, they oftentimes use the wrong treatment. So it's really hard to get well from low thyroid.
Yeah, and one of the things that's tough about this is that I know for a lot of people, they're coming out of pocket cash to deal with this because insurance won't pay for it. With me, because my test said that I was within the range, I had to pay $350 for my blood test. If it had been not within the range, had I been dying from hypo or hyper, then insurance would have paid for it. And it doesn't seem like it makes any sense that if you're looking just to feel normal.
Well, as the earlier physician, Dr. Davis, talked about, the blood tests have such a broad range that 95% of the people fall within the range. It's as wide as the Grand Canyon, as tall as the Empire State Building. So your range of thyroid may have been here when you're young and you felt great, it was at an optimal level. Now as you mature, it's down here at the bottom. Well, and if that governs your energy level, and it does, and you go from this much thyroid to this much thyroid, but you're still in the range, you think it makes a difference in the way you feel? Yeah, it does, big difference. But the doctors say, well, we're not going to treat you till you go under the range.
Right.
We're not going to take you out of the pool until you really drowned. You know, and so. And it's better, so as your thyroid level declines, you're going to have symptoms. What? You're going to have low energy, difficulty with weight, can't think clearly, joint muscle aches and pains, mood swings, depression, can't sleep well, hair falling out, lack of romantic moods and inclinations, recurrent chronic infections. All these things are problems that women and men often develop in midlife. And so when they
It's aging. Is it really what it is?
It's the aging process, and it's the loss of your hormones, thyroid, your sex hormones, and adrenal hormones. So as the hormone level declines, and we have the symptoms, all the symptoms of low thyroid, but it falls within the range, but you have the clinical symptoms. Let's do a therapeutic trial, empirical trial, and give you a little thyroid and see if we can kind of get you up in a better range. And guess what, surprisingly enough, happens. People feel much better.
But there are some doctors who take issue with that.
Well, they do, because these are the doctors that don't want to treat you if you fall within the range, and they want to treat you with. So you come in, they go, you're within the range, so your problems aren't thyroid, they're in your head. You're on antidepressant, and you're on blood pressure medication, diet pills, sleep medication, and a host of pharmaceutical drugs, which really aren't the cause of the problem to begin with.
We only have a couple of seconds left in this segment, but if you gave a message to somebody who is still not feeling well.
It's your body. You know it better than any doctor. If you don't feel well, talk to your doctor, him or her, and get changes made. Take control of it.
Jerry?
Absolutely. It's your life. And if you don't step in now and take control of it and say, no, what you're saying is not good enough, I'm going to find somebody else, then you're the one who's responsible.
All right. Thanks to Dr. Stephen Hotze, and you can catch Dr. Hotze on his radio program, Health and Wellness Solutions, Monday through Friday from noon to 1 p.m. on 1180 AM KVCE radio. You can also listen to him live online at drhotze.com. When we come back, our medical experts take your questions related to hormones so we can work it out right here on Great Day Houston. A chance to ask about this thing called thyroid, because when we talked about the symptoms up there, how many of you have suffered from some of the symptoms? Tired, skin, hair loss? Raise your hands high. Let me see. Okay, just about everybody. Okay, all right. Okay, you had some more questions, and Amy, you wanted to ask what?
Once you get your medication regulated, are there certain times should you try it and have it checked every single year? Do you have it reevaluated only if you get symptoms again, or you know?
It should be. You should evaluate once you normalize and you feel well, you'll need to check it on an annual basis. Right.
All right, I'm going to run way over here because I know there's a question up here as well. Hi there, ma'am.
Hi, how you doing? I was diagnosed with breast cancer in 1998, and after being diagnosed with cancer, I had thyroid problems right after that. It's been 10 years now, and now the doctor said that my blood work is fine. I can get off the medication. I was wondering, should I really get off the medication? I'm on Synthroid, 0.05 milligrams of Synthroid.
Sakina, Dr. Davis, you're shaking your head.
Absolutely not. Why would you take you off medication if you're doing well? That doesn't make sense. You're doing well because you're on the medication. So it wouldn't make sense to take you off the medication. I see that all the time. I was doing great, so my doctor took me off the medicine. That doesn't make any sense. I mean, part of the reason you're doing well is because you're on the medication. So I would definitely stay on it.
Yeah, let me dovetail off of that. Oftentimes women have a question about taking hormones, period, because they feel like, could it cause breast cancer, or could it cause it to grow faster or complicate breast cancer? What's your take on that?
Yeah, the jury is still out as to the cause of breast cancer and its relation to estrogen. Might estrogen be the gasoline for the fire? Possibly. Is it a cause of breast cancer? I don't think we've confirmed that. It definitely causes anxiety for a lot of people, but like you've said before, and these other panelists have said, speak to your doctor, get an individual opinion, and if you need a second opinion, get a second opinion.
All right, I'm going to run over here. We have some members of Franklin Beauty School with us today in the audience, and they had, of course, some hair questions. Oh, you're doing some fancy camera work there. Thank you. All right, and you wanted to ask a question about how it could impact hair?
Right, like, you know, is it a way that you can keep doing what you normally do and keep your hair healthy?
Yeah, if you're taking the medication, how does that impact hair?
Well, one of the classical features of hypothyroidism in women is hair loss. So
that was me.
And most women are going to develop symptoms of low thyroid as they march through their menstrual life because of the decline and imbalance in their female hormones. So it's a very common feature for women to begin to lose hair in their 40s, 50s, 60s, and that can be treated with thyroid. That's a classical feature of low thyroid.
Yeah. And you wanted to ask another question related to hair?
Yes. If the bulb is destroyed, will the hair grow back after or during medication?
You'll have to talk to our OB-GYN about that.
Yeah, I will tell you that, no, mine fell out, mine grew back. So, and it was the medication, I think, and I'm thinking that's what it was, that helped to grow back because it kind of normalized my thyroid.
We're not wanting to talk about it.
Yeah, what are y'all talking about up there?
Yeah, I always say we're not wanting to be asking about hair loss.
Okay, we'll ask Sakina about that. She knows, right? But it does, even when you are having a hypo or hyper situation, it can affect your hair, and also the medications you take can affect your hair.
Absolutely. There's so many different things that can affect your hair, but it can come back. It can. I mean, I actually, through medical school, lost huge parts of my hair. You would never believe that because I have so much, but I lost huge patches, and thank goodness it's all back. So it comes back.
Yeah, there's no doubt that this is a different hair loss process. It's not the typical, it's not the traditional male pattern hair loss, which deals with testosterone issues. And so the thyroid disorder and its association with hair loss is reversible when you replace thyroid appropriately, like you've seen, like most people will relate anecdotally.
Okay, I want to get a thought from each one of you that you want to leave people with today. And Dr. Hotze?
If you're sick and tired of being sick and tired, you can get yourself healthy and well by replenishing your hormones as you age, your thyroid, your adrenal hormones, and your sex hormones.
Yeah, if that's the problem. Dr. Jane?
Yeah, we as doctors know a lot about science and medicine, but you as the patient know a lot about you. And if you're not getting the help that you need or you think that you should be getting, you need to get a second opinion.
Dr. Davis?
I think it's so important that you educate yourself. You need to learn what's going on in your body, why it's going on, and how you're going to help yourself. That's the most important thing.
All right, and we'll put all the information in on our website, greatdayhouston.com. Thank you all very much for joining us today. And when we come back, we're switching